Veronica's creative talents then drilled a hole in the top of the helmets and made these floral arrangements that we've used over and over and over again. I think 10 years from now we'll be seeing these helmets somewhere.
They're fabulous. But I do want to give you a minute, Veronica, to tell us about community groups getting involved in this campaign.
Absolutely. And first, I just want to thank Travis on your team and Lisa Listella on our team for being able to get some of the Cancer Center images online and woven into the show. So thank you to your people and Lisa on our team for being able to do that.
Good.
And we're really excited. We have community groups that are coming forward without even being asked to support the Cancer Center. And we're so fortunate to have that kind of relationship with people. But the first group and the first pledge we received for the Cancer Center project was from the HealthAlliance Guild. And they pledged $125,000 to the project, and they were the first gift. And it's really, that was the catalyst that helped get other people excited and other people to come to the table and commit their contributions as well very early into the campaign. And the Guild also has established a new tribute garden on our Leominster campus, and that's going to be a fundraising project specifically for the Guild now into the future, but currently it's helping raise their $125,000 towards the Cancer Center. And then we've also had some other groups that have shown significant interest. Rhonda's Walk, who has a walk. This will be their third walk in May for the Cancer Center. And then also Crossroads Community Church has come forward as a group, and they're going to help us build the tribute garden to save on resources and funding. So,
we do live in, I always say that on the show, we live in a very generous community.
Absolutely. Yes, without a doubt, without a doubt. And people are coming to us asking how they can help. So we couldn't be in a better position. And Patrick's worked very hard. He's been with HealthAlliance 7.5 years now, and he is out and about building relationships. So the fundraising piece in a struggling economy, and it's still a challenge, but it's coming much more naturally for us because the relationships have been cultivated for 7 years already.
Right.
So we're fortunate.
And Patrick, what will, I mean, you are all behind the scenes. What will patients and visitors notice most if they come to the new Cancer Center?
Well, it's a lot about building the right colors, having the right design. Just a very quick example, in those areas where people will be treated with chemotherapy, so they'll be sitting for an hour to multiple hours. We've replaced all the windows so that they're, instead of maybe a 4-foot window, they're now full floor-to-ceiling windows, and we've moved where they get their treatment around to the south side of the Simonds building so that they look out over the valley. And it is just stunning, natural environment that you're looking at, and now a floor-to-ceiling window. So that's just one small example of the detail that we've gone into. Floors, wooden floors, colors that are appropriate for a soothing environment. So there's the building, and I think as soon as you walk in the front door, and that front lobby is probably 60% complete right now. The furniture isn't in and out, but it is. You walk in and you go, wow, this is really gorgeous. Not that anyone wants to walk in with cancer, but when you do, you are going to walk in and feel very confident that you are in the right place, close to home, to get your care. But as you've said, and Mary Jane, who's been here for 28 years, Mary Jane epitomizes the care that is delivered in the Cancer Center, because it is still people. It's Dr. Toke, it's Mary Jane, very compassionate people delivering care to their friends and neighbors. And that's the core of our Cancer Center. It's great to have the most cutting-edge technology and the beautiful surroundings, but it really is the care and compassion with which we deliver our cancer care.
Okay, excellent. I'm glad you pointed that out. And what is the time frame for completion of this major project?
Yeah, you know, it's moving along very well. We're on our time frames. We're still within our budgets, which is great. So we expect that by early spring, the physical plant aspects of this will be completed. The new linear accelerator will be up. And so we're very excited about, it's not something that's going to happen 3 years from now. It's going to happen this spring. Some of the programs, some of the service programs, the survivorship program, those will probably start late spring to summer time frame. So this will be an ongoing rollout maybe March through middle of the summer.
Well, that's surprising that you're going to get it done that soon.
Yes.
Dr. Toke, if you can kind of give us maybe a capsule version of why you chose to specialize with cancer patients.
Cancer, I mean, many things why I chose, and since I got into medical school, I did want to go into cancer specialty. Cancer is growing. There is a huge need for cancer specialists. I think all over the country there is a deficit of cancer specialists actually. And this is where we can interact. We can interact with patients and their families and empathize with what they are going through. And that's one part. And the second part is cancer is, we have come a long way in cancer, in diagnosis and treatment, but there is a long way to go still. And because of this ever-changing field and new challenges and new treatment options that we can offer patients, that was what lured me into cancer specialty.
I would also add that Dr. Toke has been with the Simonds-Sinon Regional Cancer Center for 5 years now.
Yes.
And it was just really within the last 2 months, 3 months, that she has been appointed by both HealthAlliance and UMass Memorial Healthcare, because this is a joint venture with UMass, as our new medical director. So she has earned that, and I know will serve our patients and serve the center very well.
Congratulations. And Mary Jane, you've seen a lot of changes over the years. Is there a vast difference in the chemo treatment, the after effects, the side effects now versus years ago?
Oh, absolutely. There's many new treatments that have come as the years have gone by than what we used to have years and years and years ago. Even some of the doctors I work with today don't even remember some of those treatments because we've come a long way. So there's a lot less side effects today, and we have a lot of supportive drugs today that we can control side effects that we didn't have in the past. So every treatment is different and every patient is different, but the technology and the care that we have today and the drugs that we have today have come a long way. So I think the fear that patients have and have heard from their family and people in the past are really not there anymore, and we have to dispel some of those fears with patients.
Yeah, thank you. And Veronica, how can the community get more involved? What did they do, and if they want to help, how do they do it?
Oh, that would be wonderful. We have information on our website, which is www.healthalliance.com. We also have our development and marketing office phone number, which is 978-466-2258. People are always welcome to email me, and it's vrosa@healthalliance.com. And we are very excited to share that on Monday, the 14th, we're launching our brand new foundation website, so people can actually go to that, and we're going to have updated information on our foundation website as well as on Facebook starting on Monday. And that website address is going to be healthalliancefoundation.org, but it won't be up until Monday.
It says .com on my sheet. Is it .org?
There's two sites. We have our Health Alliance Hospital site, and we're also going to have our new website for the foundation.
Okay.
Yep.
All right.
So we have two sites now.
Okay. So people should just go to the website and find out how they can get involved.
Or call or email.
And Patrick, I'm always somewhat in awe of someone in your position, where it is such a unique combination of knowing the medical world and business administration. How do you balance all that in a minute and a half? No.
I can do it in 15 seconds. Have a great team. So we have a terrific senior management team, general management, director and management team that knows their specific areas very well. No single person could run an operation like HealthAlliance Hospital or Central New England Health Alliance. And also the clinical team, Dr. Toke, the second time I've done that. Dr. Toke is a wonderful example of the physician leadership that we have throughout HealthAlliance Hospital on the medical executive committee and chairs of various departments and medical directors like Dr. Toke. They make my job, the senior management team, the management team, all the dedication of the employees, For instance, just through this past, really, all the employees really shined. A weekend ago, it's hard to believe 70 degrees out today, and that we had our first nor'easter. The Leominster campus was without power for about 48 hours. People were just responded very, very well. So it really, I'd like to say it's easy. Everyone works very hard, very committed to the values of HealthAlliance Hospital, and very pleased with the outcomes we're achieving.
Are you the largest employer in the area?
We are. We have over 1,500 employees, 300 members of the medical staff, a couple hundred volunteers, and everyone rallies around the mission of providing excellent patient care.
But I would think of the management staff and the medical staff, you have people coming to you all the time with their own wants and needs and pet projects.
Well, that's the challenge. You know, we're a big organization. It's almost $200 million in revenue. But we have our limitations. We can't do everything. But that's when the board comes into play, management making its recommendations through medical executive committee to the board as to how we will spend those limited resources.
And Veronica, there still is a need for volunteers at hospitals.
Absolutely. We're always in need of volunteers, definitely. And we have well over 200 volunteers. Heidi Gennick manages our volunteer program, and we'd love to have more volunteers.
And again, how do people get involved?
They can email hgeddick@healthalliance.com or call again 978-466-2258, and we'd love to hear from them.
Okay. Is there any one thing we've forgotten to say? Did we cover it all, folks?
Did you notice the color scheme?
Very good. Did you plan that?
Yes, we did.
Very good. It all goes together
What did I
very
mention
well.
before about details?
Yeah.
Veronica takes care of the details.
Yes. Thank you very much. We would certainly wish you much continued success with this project.
Thank you,
and
Barbara.
I thank you for watching. Hope you'll join me again next week when my guests will be Maestro Wada from the Thayer Symphony and Melissa Tata, who is, I believe she's president of the Society of Women Engineers. So it's going to be an interesting show. I'll be here. I hope you will. This is Barbara Foster saying good night and God bless you.